Hi everyone. Today I'm going to tell you different stories. It's going to be a small game that we are going to play. From my stories, can you guess what topic we are discussing? Story 1. Meena. She is a young girl from a remote part of Tamil Nadu in a hilly area. She is famous in her school for her brittle nail and for eating chalk. Her teacher one day notices this abnormal behavior, takes her to the nearest public health center, and gets her treated. Mr. Mohammed is my second individual, lives in a village in Uttar Pradesh. He is a farmer by profession who is active chipri always. He becomes extremely tired and fatigued all through the day after the work. One day, his granddaughter from city comes to visit him, and she notices that her grandfather, who's usually active and chirpy, seems to be very tired and exhausted, and she takes him to the doctor and gets him treated. Mr. Rajesh is my third person who also is a city dweller. He is in a MNC working 24/7 busy at work, but he has one bad habit, that is to consume alcohol every single day. One day he starts noticing yellowish discoloration of skin, and all of a sudden he vomits, and there is a huge amount of blood noticed in the vomit. His wife panics and immediately takes him to emergency. Ria is a girl who lives in Mumbai. She is an aspiring model. She wants to be like Snow White and make all her fans' heart flutter. Unfortunately, she notices that instead of her fans' heart fluttering, it is her own heart that is fluttering too much. And she immediately rushes to the doctor and she realizes how stupid she had been in not taking care of her health. We also have Mrs. Shweta, who is working for an MNC, an engineer by profession. She is pregnant. She notices too much of breathlessness and fainting episodes. She visits a gynecologist, and her gynecologist treats her, and she is comfortable now. So, as many of you have already guessed, yes, today the topic is anemia. From all these different scenarios that I've mentioned, all must have realized that anemia can be present in different forms. It is not that in every single person all symptoms have to be present. And remember, even if you have anemia, you won't be manifesting at all. You will be totally asymptomatic. Or your anemia with some other condition can mask this symptom and you will present totally in a different fashion. So it is always advisable that you get a health check or a health screening done at least once a year so that we can detect these simple preventable conditions and lead a healthy life.